patient today asked about Remeron or mirtazapine. Mirtazapine is a medication used to treat major depressive disorder, and it's known for making people feel actually rather tired when they take it, and also for inducing an appetite, so really increasing one's appetite. At first glance, you may be wondering, like, wow, why would anyone take that medication? But what we have to think about is for a lot of individuals, when they get depressed or when they fall into a significant depression, they have a great deal of difficulty falling asleep, or their sleep becomes rather broken. And so taking a medication once a day at night before bed that helps you to fall asleep and stay asleep could actually be extremely beneficial for bringing someone out of a depression and having them feel better as they're coming out of a depression. And also, a low appetite and weight loss can be very common in depressions. And so for some individuals, taking a medication that can really stimulate their appetite can also help them to get proper nutrients and bring them out of a depression faster and help them feel better faster when they're in a depression. Remeron, which is mirtazapine, is a medication that works. It's not quite the same as an SSRI or SNRI or some of the other antidepressants out there. It works on some alpha receptors within the both pre and postsynaptic between neurons in the central nervous system. It affects several serotonin receptors, several 5-HT receptors by antagonizing them, and it also affects histamine, and so it actually has some anti-histaminic qualities, and that's one of the reasons why it induces appetite. It makes people feel pretty tired, and it can also make someone a little bit dizzy or lightheaded, or if they stand up, might make them feel too fast and might make them feel a little bit dizzy. So you got to be careful with this medication, just like many psychiatric medications. Just like any antidepressant, it has the possibility of someone who takes this medication might have suicidal thoughts. But with that being said, untreated depression is the leading cause for suicide. And so if you have difficulty with depression, I would recommend you talk to a mental health professional and discuss the risks and the benefits of taking a medication like Remeron. But if anyone has any suicidal thoughts, it's incredibly vital that you get to the ER, crisis center, call 911, have someone be with you and make sure that you're safe. This video is purely informative, and if you feel that any of the information in the video may pertain to you, please be sure to speak with a mental health professional at an appointment.